COVID-19 is a disease from the virus SARS, severe acute respiratory syndrome. It's a part of the coronavirus family. It is a single-stranded RNA molecule. It is named after its crown-like spikes along its protein border that it uses to invade a hostess cell. It was traced back to Wuhan, China in December 2019. It is a zoonotic virus that could have been from bats or pangolins. In March 2020, it was declared a global pandemic. Since January 2020, the U.S. has had over 11 million cases and over 250,000 deaths. The incubation period for this disease is 2 to 14 days, where a person may experience flu-like symptoms such as fatigue, cough, fever, or shortness of breath. Complications with this virus include pneumonia, acute respiratory distress syndrome, and septic shock. Long-term effects increase a risk for heart failure, long-term breathing problems, blood clots, and if a patient has had the virus, they sometimes have PTSD from being on the ventilator and having that anxiety that comes with not being able to breathe. It is spread through droplets such as coughing or sneezing, or touching somebody who is infected with the virus who's coughed and sneezed into their hand. That's why hand hygiene is so important. Fecal oral route, the virus gets into the mouth or the nose and travels along to the upper and lower respiratory systems. COVID-19 uses this S spike on the type 2 cell of the alveoli where surfactant is made. The protein ACE2, angiotensin converting enzyme, is the lock. Once it is unlocked, thus the virus gets into the cell where it attaches its RNA to a host ribosome, where polypeptides are made, and then assembly proteins are made, and the virus replicates itself and puts itself back into the alveoli. Once the virus is released from these cells, it causes them to swell and burst. Cytokines is released, which is a chemical that causes permeability along the vessels, which causes plasma to leak into the alveoli and increases the permeability of the alveoli border, which it makes it difficult for gas exchange to happen. This is when patients start getting on ventilators. Also, if we destroy the type 2 cell, there's no surfactant being made, so it causes alveoli to collapse. Once it affects the lungs, it can move on to other systems of the body, leading to multi-organ shutdown. COVID-19 lab tests include PCR, which is polymerase chain reaction test, which is a nose or throat swab. The antigen test, the PCR test detects if a patient currently has a virus. The antigen test, based off of a person's viral load, can tell if a patient has been infected in the past. Treatments include supportive care for symptoms, which include oxygen, pain relievers, which can be over-the-counter fluids, and rest. A patient will be very tired. Trial medications that have shown benefit include convalescent plasma. This includes plasma of patients who've had it in the past. Dexamethasone, which is an IV steroid, and remdesivir, which is an antiviral. Effects that it had on me is I went from a non-bedside job where I had very flexible hours to a 12-hour shifts. This caused a lot of anxiety because I took that job to benefit my family, and it was a makeshift unit. It was just a scary time. For future me, I believe that having worked on the front lines and gone through this pandemic, I'll be better, hopefully be better prepared if something like this were to occur again. I feel like a lot of us have learned a lot, and hopefully what we've learned and what we're learning now can benefit not only us as nurses, but our communities if this were to happen again.